Now, the other thing which we need to talk about is healthcare disparities. And I mentioned this earlier, but these healthcare disparities are there in terms of human resource, they're there in terms of health facility density, in terms of you've got such huge disparities in terms of the regions, the number of facilities you have in different parts of the country, and then the other things to do with the proportion of healthcare resources that are financed out of pocket versus pre-financed also varies greatly from one region to another. And lastly, by law, the 2017 Act, there was an issue about there's a constitutional right to health. And that, if you ask me, there has to be an addressee of those rights. I don't think that responsibility falls upon the citizen or private investors. It is a responsibility of government to be able to deliver healthcare for its citizens. Now, when we had the issue of emergency response, and this is a challenge that has been going back and forth. You have got people who get accidents and they rush to health facilities. Who is supposed to meet those bills? There was a proposal in 2017, and in fact it was legislated that there was an emergency response fund which was supposed to be set up. It has never been operationalized. And that needs to be done so that you can also encourage, for example, private health facilities are run by private investors. You cannot have them incurring huge costs which are never compensated consistently to be able to take care of. And that, you know, it's also against the law to be able to detain people for not paying bills. So there are a lot of facilities, especially those who are located along major highways, incur enormous cost in terms of being able to provide healthcare services to citizens. And I think that's the role of the Emergency Response Fund. So I'll keep it at that. If there are any questions, maybe you can, I can address them. Thank you.
Thank you very much.
Iwapo unapenda habari nazokuletea, basi subscribe kwenye channel hii ili uwe unapata uhondo kila wakati. Shukran.